come in. I've been actually waiting for you, but not for too long. That's alright. You're really punctual patient, so no worries about that. Well, how are you doing today? Okay. Can I offer you anything? Maybe like some water at least? No, you're sure? Well, whenever you feel like you need something, just do let me know, okay? Yeah, you can sit right here. Yeah, if that's alright with you. Okay. We have some extra cushions right there, so you can take some just in case. Yeah, I just want you to feel really, really comfortable. Yeah. Well, is it your first hearing test ever? No, it's not. Okay. How many have you had before, if you remember? Alright, well, I suppose that as an experienced patient, you already know like what's gonna happen. So maybe I will surprise you with some unexpected test or something like that, but that's a pretty much standard procedure. So we have different kinds of tests. I hope that all of them will be quite enjoyable and relaxing. No need to worry about anything. Please just don't hesitate before giving me your answers. Yeah, so don't be afraid of making mistakes. That's totally fine. Just try to relax, but also stay like concentrated. Okay, that's possible. That's all right. These tests, they are not like extremely challenging. There's nothing super complicated about them, so it's gonna be fine, I promise. Okay, let me just confirm your personal data first, really quickly. Okay, so your first name, now your last name, your home address. That's not like absolutely necessary, but that would be great too. No worries. And I'm gonna pop over at your place. Okay, well, now your email address. Could you spell that? Okay, and your phone number. Good. Okay. Do you have any complaints regarding your hearing? Have you ever had any problems, any troubles, any complications after some diseases, maybe after some colds? Sometimes it happens. Okay. How would you evaluate the acuity of your hearing? Like on the scale from 1 to 10, let's say, where 1 is like very bad and 10 is like you can hear everything. Okay. Okay. Good. Well, have you had any ear cleanings lately? Okay. I will have a look at your ears briefly. I will have a look with an otoscope to see if there are any kinds of wax buildups or something like that. Sometimes it happens. It's not as nasty as it sounds. So, yeah, there's nothing really horrible about that. It's just, yeah, like sometimes it happens when you like either clean them way like too much. Sometimes it happens, especially when people use Q-tips to do that. You're not supposed to do that, you know, right? Well, yeah, ideally just wash them with water and then try to soak the water with some kind of a towel or something like that. Well, but in general, sometimes it happens when we use some kind of earplugs, earphones way too much, and then our ears start producing more like earwax than like usually. So it can also happen. I mean, there can be multiple reasons for that, but well, I do hope that when I'm gonna do this ear cleaning today, well, but at least we'll see, okay? And then I'll let you know. Yeah. Alright, well, do you have any questions? Any suggestions? Okay, well, let's have a look at your ears first. Before we start, I just want to know what's going on there. Okay, give me a second, please. Right, so it's gonna be fine. I'll put my latex gloves on. But again, no need to worry about anything, okay? So it's not gonna hurt, at least it's not supposed to. In case if you feel some kind of pain or ache, whatever, discomfort, please let me know and I will stop immediately, okay? Good. So, what if I press here, just like that? Can you feel my both hands symmetrically on both sides of your head? Any unpleasant feelings? No, that's fine. What if I press here? Good. Alrighty. Oh, let's notice. Let me see. That side. No. I don't see any wax buildups or stuff like that, so the ear canal seems to be just alright, the way it's supposed to be. If you have some doubts, okay, I will have a look again, sure. No problem. Seems everything fine. No, like I said, it's just alright. Okay, now let me have a look at the other one. Good, all good. All looks good to me. No, that's alright. Well, oh good. Okay, well, you know what? I think that we could actually proceed with the test itself. There will be a few different kinds of tests, okay? I guess that today we'll start with the beep test, right? So it's not gonna be too challenging, I promise. It's usually it's a lot of fun. Our patients just love the beep test. Sometimes we put it off up to the end of the test of the exam, you know. But today I guess that we could just change the order, you know. Yeah, make it more unpredictable, maybe. So you said that you're a pretty experienced patient, so I don't want you to get bored. So we'll start with the beep test right away. I hope you don't mind. Okay, so I have these wonderful headphones. They're very soft, very gentle. They feel really good on your ears and your head. They, yeah, absolutely. So let me help you with them, okay? I will help you to put them on. Okay, just relax. That's all right. And let's do it this way. Okay, no, that's all right. Does feel good? Okay. Just let me a second. Oh, okay. Now that's much better. Can you still hear me well? Okay, wonderful. Good. Righty. So I will just take these off. And now the beep test. So the very first task would be to tell me when you actually hear the beep sound. Okay? So we're not gonna start with something hardcore. It's gonna be pretty easy. Just let me know when you hear the first beep sound, maybe the only one. Okay. Are you ready? Okay, just relax. You can nod to me, you can raise your hand, you can just tell me beep, yes, whatever. Just give me a sign, okay? Good. So let's do it. Okay, good. Now let's do it again. It might be the same kind of beep sound, it might be a bit different, who knows? So just tell me when you hear something, okay? Okay, good. Now let's do it once again. You remember, just let me know when you hear the beep sound. Good. Okay, wonderful. Well, so seems like you're doing good. Now, please let me know when you hear the second beep sound, okay? Okay, good. Wonderful. Now, once again, wait till the second beep sound and then let me know when you hear it, okay? Good. Okay, wonderful. Now the same kind of task, the second beep sound. Okay, good. That was the second one. Okay, wonderful. Now please let me know when you hear the third beep. Okay, good. Now once again the third beep. Okay, wonderful. And once again the third beep sound. Okay, good, wonderful. Okay, now please count the amount of beep sounds that you hear, okay? Can be any, from 1 to 10, maybe even more, okay? Let's go. 3 beep sounds, okay? Okay, good. What about now? 2, okay. What about now? 4. Good. 5 beep sounds, alright. And what about now? 4 again. Okay, good. 5 Okay. So 9 beep sounds. Okay, good. Let's try again. Okay. Wow. So far so good. Now please, I will ask you to tell me if all the beep sounds are the same or they are different. It can be anything. It can be the length of the sound, it can be the pitch, it can be actually like the character of the sounds, it can be some standard beep sounds, they can be some bubbly sounds, whatever. So just tell me if they all were the same or if they were a bit different, okay? No need to count them right now. Okay. So were they all the same? All the same. Okay, good. What about now? So your verdict? They were a bit different. Okay, let's try again. Different. Okay, let's try again. So all were more or less same. Okay, good. Let me type in some of your answers, please. How are you feeling? That's right. You're actually doing good. Okay, now I'll also ask you to count how many shorter sounds you've heard, okay? There might be some shorter ones and a bit longer ones. You will be able to differentiate between them for sure. So please count the short sounds, okay? Good. So, 2 short sounds. Good. Let's try again. just one short sound. Okay, let's try again. Three short beep sounds. Alright. And once again. Okay, so just two short sounds again. Good. Okay. Now the sounds might be all mixed up a little, so I will also ask you to count just the amount of this bubbly, like peculiar beep sounds. The standard ones, like, don't just take them into account. Yeah, don't pay attention to them. Okay? So just let's count this like bubbly ones. Ready? Let's listen to them. So just two. Okay, let's try again. Three sounds, bubbly sounds. Okay, let's try again. Just one. Seriously. Okay, and one more time, please. Alright, okay, good. Well, that was the last beep test for today, so you can take off the headphones that I gave you. Okay, let me just enter all the info. You're doing good. You gotta be proud of yourself. That's alright. And let me just okay. Okay, wonderful. Hello, how are you? Please come in. Yeah, you can take this seat right in front of me. Perfect. Do you feel comfortable there? So, would you please remind me your first name and your last name? Okay, right, that's what we've got in the system. Okay, and your email address is? Okay, good, wonderful. And your phone number? Right. No, okay, yeah, we have all your data. I'm glad we confirmed it so quickly. So I don't want to waste any of your time today. And I know that you came for your beep test, right? So hearing test, specifically a beep one. Yeah, so may I ask you, when was your last ear exam? Okay, yeah. result back then? Was it satisfactory for you? Was it alright? Did the doctor give you any kind of recommendations? Okay, and did you follow those recommendations? Okay, do you have any complaints regarding your hearing? How often do you have to ask people to repeat what they have just said? Well, I hope it doesn't happen too frequently, but still. Okay. Yeah. Got it. Right. Well, any other complaints? Have you had any kind of pain or ache in your ears? Okay. How often do you clean them and how exactly do you do that? And have you ever had like a doctor-assisted ear cleaning? Oh, when exactly did it take place? Okay, and what was the reason for that? Did you have any kind of earwax buildup? Okay, well, there can be multiple reasons for that actually. Do you use earphones, earplugs on a daily basis? I got it, okay. Okay. Well, can you avoid using them? Do you actually need them for work or something? Or is it possible to give your ears some rest from all these devices and stuff? That would be great actually. Okay. Anyway, it's fine. I might ask you some questions in the process and also at the end of this hearing test. So, and for now, let's give it a start, I guess, right? So what I'm gonna do is to put these headphones on you. They are very soft, they're very comfortable, and they are designed so that you could wear them for a long time, for a bigger amount of time, so please don't worry. They're not supposed to press on your ears or cause any other kind of discomfort, but if they do, please make sure to let me know right away. You don't need to endure the pain or discomfort or something like that. So yeah, that's not what's supposed to be like. So please, in case if you feel that you don't feel really comfortable wearing these headphones, just let me know, okay? And we'll take a pause and maybe make some adjustments. I'll look for another kind of headphones for you, so we'll make it work, okay? Yeah, sure. And also another thing, please don't worry. I don't want you to feel anxious about this test. It's just a regular test, so it's it's not really that scary or tough or something like that, so it's totally fine. It's not gonna be way too challenging for you, so you will nail it, I'm pretty sure. But even if you make some mistakes, it's totally fine, so please just relax. Exhale. It's gonna be alright. No need to worry about anything. I will put them on and you will let me know if you can still hear me well, okay? Because that's kind of important for you to be able to actually hear all the instructions as well, okay? Good. So, are you ready? Good. Okay. Do you feel good? Do you feel comfortable? Okay, good. Well, now just relax and let me know when you hear a beep sound. So that most probably there will be just one beep sound. So just let me know when you hear it. Good. Okay. Wonderful. Now, quite the same task. Exactly, you're right. Now, once again, just let me know when you hear the beep sound. It might be a little bit different from all these previous beep sounds, different in character, different kind of sound, the pitch, the lengths and stuff, but just let me know when you hear something. Okay, good. Now the same kind of task. Good. Okay, wonderful. Now, please pay attention. There might be more than just one beep sound. So let me know how many of them you can hear. Okay? Okay, good. Just pay attention. It's gonna be alright. Try to count them in case you miss something out. It's not a big deal. Okay? Good. So let's do it. So how many was that? G sounds. Okay. Right. Now once again. Three sounds. Good. What about now? Four. That's right. Good. What about now? Two sounds again. What about now? Five sounds. Good. And again. Six sounds. Well, that's quite impressive. Once again, please. Just three sounds. Okay, good. Gotcha. Well, that's great. Now, please let me know when you hear the second beep sound. There might be a different amount of them. I'd like you to tell me when you're gonna hear the second one, okay? That's important. Good. Just give me like a nod, or you can raise your hand, or you can say yes, you can say beep, you can say whatever. Just when you can hear the second one, okay? Deal. Good. One more time, please. Okay. Once again. Yes, that's right. Okay. Now let me know when you hear the third beep sound. Just nod. Or shake your head, whatever. Okay. Good. Do you feel alright? Can I get you into maybe some water or... Okay. Good. So the third beep sound you remember. Please just pay attention. Okay. Let's go. Good. Good job. once again the third beep sound. Wonderful. And now once again. Okay, good, good. Now, please let me know if all beep sounds were the same, or if some of them were a bit different. Maybe some can be longer, some can be shorter. They can be, for example, like beep, 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 beep. Or for example, beep, beep, beep. Yeah, so like one of them can be longer, or maybe all of them can be longer and then one shorter sound. So whatever, there can be really different combinations. But just let me know like which one was different, or like how many short and how many long sounds you were able to hear. Maybe all of them are the same, then also let me know. Okay, let's do it. So the first attempt. So you're saying that all of them were the same. You're actually right. So that was a tricky task and you did it well. Now listen again, please. Okay. So the last one was longer. Okay, good job. Now once again. Okay, good. So now the first one was longer and then 3 shorter sounds. Okay, now please try again. 2 short, 1 long. Good. Now once again, please. Now the other way around. 1 long, 2 short. Okay, now once again, please. Okay. So now there were like 3 short, 1 long, and then the same 3 short, 1 long. Okay, quite a lot of beep sounds. Great, so you managed to count them to catch this rhythm. Amazing, okay? Now once again. So there was 1 long, 3 short sounds, and then once again 1 long, 3 short sounds. Good. Now let's give it one more try. Two short, 1 long, 2 short, 1 long. Okay. Now once again. Short, 1 long sound and 2 short ones. Okay, and now please the same thing, just keep on listening. Let's try. There are a few more patterns that you need to hear. So there was 1 short, 2 long sound, then again 1 short, 2 long. The second long, I mean. So short, long, am I right? Did I get you? Okay. And now once again. So you're saying that it was quite similar, but the other way around. Low on short, low on short. Okay, I got it. No, that's alright, that's fine. Good. Oh, that's actually pretty impressive. You're doing really well. Okay. Anyway, now a little bit different thing to do. I will ask you to tell me how many short sounds you've heard. So please ignore the long ones. Just how many short sounds you've heard, okay? Okay, good. So there were 3 short sounds. Okay, that's fine. Now once again, how many short sounds you've heard? 2. Okay. Now once again. So there was just 1 short sound. Okay. Now please try to count the long sounds. Okay, so there was 1 longer sound. Good. And what about now? So there were 2 longer sounds. Okay. Now once again. So how many? 3 long sounds. Okay. And now one more time, please. So there were 4 long sounds. Wow. That's quite a lot. Okay, good. No, you're right, absolutely. Okay, good. Now, on to the next one. Please let me know. Like now, the beep sounds will be a little bit different than the ones you heard previously. They will be just different in character, but no worries about that. So I will ask you just to count them, okay? So you probably got used to these previous ones. Now you could differentiate between them really well. So you could identify the shorter one, the longer ones, and stuff like that. Now let's switch to a little bit different, just kind of sound itself. Just count how many of them have you heard. Good. 3 sounds. Okay, good. What about now? Four sounds. Okay, great. What about now? So you're saying that you could hear 6 sounds. Okay, wonderful. And now? Five. Okay, now once again. Seven. Okay, good. And now? There were like 10 of them. Okay, great. Good. Now, I will ask you to let me know when you heard the second beep sound. We have done a similar task before, but now since the sounds are a little bit different, let's check how well you can hear them too, okay? So nothing unusual. Let me know when you can hear the second beep sound. Let's do it. Of course, good. Okay. And now. Yes, that's right. Okay, now still tell me about the second one. Okay, good. Now, please tell me when you hear the third beep sound. Good. Great. Now once again. Wonderful. And now once again. Okay, awesome. Good. You're doing so great. Now, I will just ask you to pay attention if the beep sounds are in your left ear, in your right ear, or in both. Okay? So if you can hear the beep sound symmetrically in both ears, or maybe it's only right ear or only left ear. Okay? Deal? Good. So let's do it. I believe in you. That's fine. Okay, so that was right ear. All right. What about now? That was right ear again. Okay. What about now? And that was left. And once again. Both. Okay. And once again. Okay, left ear again. Okay. No, that's good. Good. Right. Well, now, please try to count how many beeps you could hear in your right ear. I'm not sure if there's gonna be any sounds in your left ear or only in your right one, but you have to count the ones, like the sounds that you've heard in your right ear, okay? Okay. Good. Two of them, okay. And what about now? The same right ear. Three sounds. Okay, good. And what about now? Just one sound. Right. And now your left ear. Quite the same task. Just tell me how many sounds, separate sounds, you would hear exactly in your left ear. Okay? Wonderful. Just one. Okay, and now? Two of them. Right, and what about now? Three sounds. Okay, got it. Well, great. And now once again, tell me how many sounds did you manage to hear on both sides the same way? Yeah? Okay. Just two of them were simultaneously in both ears, okay? And now? Three sounds. Okay, good. What about now? Just one. Okay, fine. No, you actually You did really, really well. Well, you seem to be a little bit tired now. Are you? Okay. Well, you know what? I guess that you can take these headphones off. You definitely need to get some rest. How are you feeling now? Are you sure? Okay, maybe you'd like a glass of water, or yeah, okay, right. Yes, like this beep test, it really requires a lot of concentration, so you need to focus and you need to like be like really, really, you know, I wouldn't say tense. You can still be relaxed, but you simply need to pay attention, to be concentrated, to be focused. And of course, it's still a little bit tiring, so if you feel tired, I totally understand. In general, how do you feel about your results? Was it really that challenging for you, or could you hear everything really, really easily? You know what, let me have a look with an otoscope, okay, for just for a moment, because I asked you some questions about your ear canal, yeah, about the earwax and stuff, but I never really checked it myself, okay, so so that looks great to me. Now to the other side. That's alright. Absolutely. No, I don't see anything abnormal. It's like totally fine. There's nothing excessive in your ear canal. Well, at least I can see it. So yeah, I would say that you just need to give some more rest to your ears, especially after this hearing test, after the beep test. I hope that now you can't hear any beeps anymore, right? Okay, so no like other sounds, no ringing in your ears. Is that all right? Okay, good. Yeah, well, I think that you will have to come and see us for your other ear exam, but there's no hurry with that. We also have some tuning forks for your other ear exam. I will just show them really shortly to you. So, and we also have this one in another color, and then one more. So yet another color too, and they are all different frequency. Yeah, we didn't practice so much of this today, so there were some different kinds of sounds, but they were all like more or less the same frequency and stuff. So and with these tuning forks, they will let you, and they will let us check some other aspects of your hearing. Well, and then we also have some brushes and some other stuff. So like these ear exams, they are usually like a lot of fun. So I guess that you'll be able to make your next appointment right there at the reception desk. But once again, like I said, there is no hurry with that. It can wait for a month or even longer. So yeah, but if you're willing to do it as soon as possible, then just yeah, you can book an appointment with us. So anyway, do you have any questions to me? Okay. Are you sure? There's no hurry. You can think about it while I'm typing right, some info about your hearing test. Good. So once again, how are you feeling? Are you sure that you're not feeling dizzy or anything? Just to let me know. This can be quite different. Sometimes people can feel quite, you know, like I said, a bit exhausted after these beep tests, or sometimes way too relaxed so that it's even hard for them to move. Yeah, sometimes it can make you feel a bit sleepy. So just let me know. Are you sure that you feel okay? Okay, good. Can I trust you on that? Okay, I hope so. Well, anyway, thank you. Thank you so much for working really hard, for focusing really hard on what I asked you to do, for following all my instructions really precisely. So I do appreciate that. And then the next time I see you, we'll do some other tests, like I said. So I feel really excited about it. But once again, like I said, there's no hurry. So then, if you don't have any other questions to me, I guess that's I'll say bye for now. Sure. Have a good one. Yeah. I'll see you soon. Right. Bye.